So what do you need to heal a wound? What kind of food should you be eating? Well, I think it's helpful just to look at what is the tissue that you're trying to build. It's just like an animal protein tissue. So that is really what you want to be eating, is those animal proteins. So the for so long demonized beef, chicken, steak, salmon, shellfish, all of these things have the very things that you need to build the new tissues that you need. The other thing, although it's not so embedded in the new tissues, but you also need a lot of vitamin C to build new tissues. So I would recommend, if you're trying to heal a wound, minimum of 1,000 milligrams of supplemental vitamin C, in addition to whatever vitamin C you're getting in the diet. I don't like to give a number of grams of protein or a number of grams of animal protein people should be eating every day. Every body is different. Every body is a different size. Also, people just some people can only handle so much protein. So rather than saying that, what I would say is have a generous serving of animal protein at every meal if you possibly can. So this is easy if you are the 1 in a million teenager with a hard to heal wound. This is much harder for grandma, who's probably the one who has that wound that won't heal. Grandma might not have a good appetite. She might have trouble chewing. She might have trouble swallowing. She might not be remembering to eat. It might be hard for her to cook for herself. So all these different things are going on that make the elderly and the disabled at a much higher risk for a wound that won't heal. And that is where those of us who are healthy and who love these people need to get creative. Pray to the Holy Spirit. First of all, the Holy Spirit loves that person more than you do and has all the solutions in the world if you just ask him. So pause and pray to the Holy Spirit, and you can consider a couple of these ideas that I'll throw out. One is just eating with the person. So if grandma is local and you can go over, maybe bring the meal over or prepare the meal at grandma's house and eat together, that really improves people's appetites. It also gives you the chance to have your eyes on grandma and troubleshoot better and realize, oh, she's having trouble swallowing or cutting or chewing or something else, and just give you more information to help her. You also have the opportunity to leave the food there in grandma's fridge that she can hopefully remember to warm up for herself the next day. You could even call her and remind her, Mom, it's lunchtime. Go ahead and warm that up for yourself. But the more direct contact you have with grandma, the better she's going to be doing. If mobility is an issue, maybe you just need to bring the food directly to grandma in bed, but maybe it would be safe and appropriate to just help grandma out of bed, encourage her, bring her walker over, help her get to the table, help her get to the fridge, whatever is safe and appropriate in the particular circumstance. But just getting up and getting moving will improve blood flow, which is very good, and also improve appetite and improve cognition, which will all snowball into better wound healing. And chewing is so often a big issue, and swallowing. So like those animal proteins can get more difficult if it's hard to chew and swallow. And there, I would say that your two best friends are going to be eggs and dairy, followed by broth. Eggs and dairy can be very easy to chew, very easy to prepare, very easy to swallow. And usually you can prepare them and leave them in the fridge to be eaten cold later. And then broth, which is definitely a little bit more work, and you would need to do that for grandma. Perhaps you could just sip on the warm broth. Be careful with the temperature. A lot of times the elderly don't sense hot the way they should, so they can get burned more easily. But you could also use the broth to cook some grains, which might be easier for grandma to get down than the proteins are. And you could also make a blended soup that grandma doesn't even have to chew. So you could chop up some favorite veggies, put in some good seasonings, add your broth, blend it up, and then she's getting that extra really good healing protein in every bite of what she eats. And speaking of grains, blood sugar is a huge thing with infected wounds that aren't healing. And I'm not demonizing grains. I don't think they're terrible. And I'm not even saying you should cut out grains if you have a wound that won't heal. I'm just saying you do need to pay attention to how those grains are affecting the blood sugar, and to how sugar and even fruit or honey or maple syrup are affecting the blood sugar. Because, and this is true of any infection, honestly, but with wounds in particular, high blood sugar just feeds the infection. If you think of the wound, like you can often see the blood like oozing out of a wound or there in the blood vessels. Every, gram higher the blood sugar is going to be eaten up by the bacteria that's causing this infection. So this is not a moment to suddenly go cold turkey if you're someone who's been struggling with blood sugar issues for years and years. This is not the moment to suddenly get on the Atkins diet. Things like that can actually kill people. So if you have like diagnosed diabetes or you suspect diabetes or blood sugar issues, reach out to a healthcare provider and figure out how to safely lower your blood sugar. And probably this can be done with diet. Goes perfectly with eating for wound healing because extra protein and the fats that are packaged with the proteins are going to be perfect for someone with blood sugar issues. And yet you do want to do that really smartly, and especially if you're taking insulin or the oral anti-diabetic medications, because you do not want to bottom out your blood sugar. That can like kill you very quickly, and then you don't have any time to heal your wound. So what was the point of all of that?